Hey, good morning, everybody. It is December 27th. We are in that week between Christmas and New Year's. And in our office, we've been talking a lot about getting started on the new year, right? Everybody is. It's kind of what's on all of our heads and hearts as we think about what we are hoping for in 2019, what we've received as blessings in 2018. And so it's no difference here at the office. We think about that a lot. And our goal is to partner with you as you move toward 2019 to help you achieve your health goals and your dreams for you and your family. And so I wanted to touch base this morning to talk about infertility because it's something that we address a lot in our practice. We see a lot of families and we see people who have successfully conceived and bore children start to struggle with infertility later on. And I also have women and husbands of those women come in and ask, like, what can I do to get ready for birth, right? What can I do to get ready to conceive? And so we have a lot of options here. When we look at fertility from a holistic perspective, we are looking at supporting the whole body. We trust and we know that our bodies are made well and that they are made to conceive and to prosper and to birth children. And so when we look at it from that perspective, we are aware that what we put in our body, whether it be food or emotions, the relationships that surround us, and how we move our body via exercise, all feed in to the better picture of allowing for conception to occur, as opposed to our current model in the United States with the traditional Western medicine. It seems to be more like infertility is seen as a condition, a disease process that we have to fight, to battle, and to force our bodies through that issue to conceive, right? And so whether it's Clomid and forcing your body to release eggs, or actually fertilizing eggs out of the womb and bringing them back in, right? That model is forcing the body to do it, and it can be very successful. But a lot of women don't want all of that, and I get those questions a lot. And so what we look at here at Crossroads Family Chiropractic is what I call the trifecta, right? You've got your physical health, your emotional health, and your chemical health. And so we have plans developed to help women and their spouses to get into better health so that we can have a body that will do it naturally without forcing it in through a stressful area. So what that looks like first is physically. Chiropractic is a huge help in just aligning the spine and allowing your nervous system, which controls your reproductive organs, to work optimally. That's the whole point of chiropractic. And so we can not only get you out of pain, but we can also make sure that your body is ready to receive a pregnancy physically. I also help women all the time with workout plans, understanding that boot camps are not always the best way to get healthy. That can be very stressful. And so finding the exercise that's right for you, that's restorative and stress relieving and not stress inducing is really important in order to conceive. Secondly, we look at your emotional health. And so with that, I obviously am not a counselor, that's outside of my scope of practice, but I do acupuncture, which means we can help with energetically aligning your body and helping you to conceive. Acupuncture has been known for thousands of years to help women who are struggling with infertility, and it's really quite simple, but it clears out any of the energy areas that are stagnant and are not flowing well. We need fresh energy and fresh life to create new life, and so acupuncture is a part of that trifecta of care. And then lastly, we look at nutrition. So it is no doubt that you are what you eat. We see that all of the time. And so being able to use nutrition response testing more and more over the past year and a half has been phenomenal to see what we can do to help men and women and kids let their bodies heal from the inside out. And so doing that to get ready for conception is really, really important. It might look like detoxing. It might look like simply taking a good multivitamin. But what I do know is that when you have the right nutrition at the right time, your body is able to do things that you never thought possible. So we are really excited here at Crossroads to partner with women. It is a journey to become a mom, and it's not just getting pregnant and having the baby and waiting for it to arrive. It is that preparation that really starts the foundation for parenthood. And we know that the Lord says children are a gift from the Lord. It is a blessing. And we want to be able to partner with you in that, to pray with you during this time. The emotional desire to have a kid and the frustration that comes with struggling with infertility or not getting pregnant right away. And that in itself can be a stress on the body, whether physically, emotionally, or nutritionally. And so we want to be able to partner with you in all of that, to pray with you and to work with spouses, both men and women. This program needs to be for both. It's not just the woman's body that needs to be prepared for birth and conception, but also the males, so that it takes two to tango, right? So that we can conceive a healthy child. So if you have any questions, or if you're watching this and you know of someone in your life who is struggling right now with becoming pregnant and conceiving a child, please share this video. Have them give us a call. I'm happy to talk over the phone, via email, and just answer any questions you might have. But we are excited to partner with you for your health goals in 2019. And if this should be one of them, I'd be happy to be there with you. Have a great day. Bye, guys.